Hello everyone, we are from Medical Physics 2 of English course Nuclear Engineering class, and we are going to present our discussion about optimization of CT scan. But before that, let me introduce myself and my friends. The first member is Andhika Abyzar Alqifari. The second member is Fadhlurrahman Musthofa Rohani. The third member is Michael Darmawan. The fourth member is Nandan Dwi Sari. The fifth member is Tiolita Maharani. And the last member is Wildan Arya Nugra. Okay, the first speaker is me, Tiolita Maharani, and I will present about description of medical physics. So, what is medical physics? Medical physics is a branch of physics that concerns the application of radiation for therapeutic and diagnostic use in medicine. Next, the contribution of medical physics. The development and implementation of modern clinical medicine owe a great deal to the contribution from physics. Physics, as applied to medicine or medical physics, is now a recognized, well-respected subspecialty of physics. The contribution of medical physics are numerous, from diagnosis such as clinical PET scanning and magnetic resonance spectroscopy to treatment such as minimal access surgery and interventional MRE. Medical physicists should also take the lead in evaluating emerging challenges in quality and safety of radiotherapy. They must be involved in clinical audits and risk assessment. Education has a crucial role in medical physics. Physicists need proper and consistent education before joining a medical physics department, and thereafter, both postgraduate education and lifelong continuous education are essential as well. Medical physics has changed dramatically since 1895. There was a period of slow evolutionary change during the first 70 years after Roentgen's discovery of X-rays. With the advent of the computer, both diagnostic and therapeutic radiology have undergone rapid growth and change. Technological advances such as computed tomography and magnetic resonance imaging in diagnostic imaging and three-dimensional treatment planning system, stereotactic radiosurgery, and intensity-modulated radiation therapy in radiation oncology have resulted in substantial change in medical physics. These advances have improved diagnostic imaging and radiation therapy while expanding the need for better educated and experienced medical physics staff.
So now, we will proceed to talk about CT scan. So, what is a CT scan? According to Suroyo, CT scan is a computer reconstruction of the tomographic plane of an object or slice. And this occurs from multiple X-ray absorption measurements around the object. Furthermore, CT scan is also described by Rohani and Shafitri as a procedure using X-rays that combines multiple X-ray images with the aid of a computer to produce a cross-sectional view, and can also display three-dimensional images of internal organs and body structure. CT scanners are made of three important elements: an X-ray tube, a gantry with a ring of X-ray sensitive detectors, and a computer. What you see here on screen is an overview of a CT scanner. To describe it simply, the CT tube transmits X-rays, which will be received by detectors directly opposite of the tube. These detectors then convert the image taken to electrical signal that can be displayed on screen. The development of CT scan is often attributed to Sir Godfrey Hounsfield of Environmental Monitoring Incorporation, or EMI, in the late 1960s. In 1971, the first use was a brain scan procedure in Wimbledon, England. Sarkotri suspected that the patient was suffering from frontal lobe tumor, which he deduced from the abnormality on the left hemisphere of the patient's brain. Before the invention of CT, neuroradiology used invasive techniques, such as conventional angiography, pneumoencephalography, and myelography, all of which presented a risk to the patient. Before CT, plain film X-rays were of little use beyond diagnosis of bone abnormalities. But with this new technology, developed by Sir Godfrey Hounsfield, CT scan permitted the evaluation of the soft tissues and the central nervous system through cross-sectional images, thus introducing a new age for neuroimaging. CT scan can be used for things such as defining normal and abnormal states of structures in the body and assist in accurate procedures for patient care, determining the amount of radiation a patient receives in one diagnostic procedure, otherwise known as medical exposure, and also for differentiating soft tissue at 0.5% transmission difference.
How CT scan can works. CT scan is used for a specific patient that can be scanned by CT scan. The patient is placed in a tubular gantry surrounded by a ring of X-ray sensitive detectors localized opposite to the X-ray tube. When the rotating X-ray beam enters the body and contact tissues or organs of different density, the beam is variably absorbed and undergoes attenuation, or decrease in energy and number of photons, which is recorded by the X-ray detectors upon its ultimate exit from the body. The detectors convert the exiting beam into amplified electrical pulses that vary in intensity according to the residual beam strength. The acquired dataset is sent to a computer that analyzes the location and density information and generates axial, cross-sectional images of internal structures of the body. In a CT scan, to produce an image of an object, the radiation beam generated by the source will be passed through an object plane from various angles. This continuous radiation is detected by the detector system to be recorded and collected as input data, which is then proceeded using a computer to produce an image with what is known as a reconstruction. The process of collecting continuous radiation intensity data on the intersection of objects from various angles is called scanning. There is a tips for a radiologist to how should a radiologist do about CT scan so that it benefits to patients. First, scanning techniques can be altered to provide acceptable images at lower radiation exposures. Possible adjustments in the tube current, the specifying of CT slices, and slice thickness could reduce the radiation exposure while maintaining diagnostic image quality. The radiation dose to the patient from CT is directly proportional to the tube current and scan time. However, scan time is usually short and constant to minimize motion blur. For pediatric patients, the product of amperage and scan time should be significantly less than the routinely used for adult studies. And the next one is the process of the images. The following are fundamental steps in acquiring data from the patient. Number 1. The tube and detectors rotate around the patient to collect a large number of attenuation readings. Number 2. The beam is shaped by a special filter called a bow tie filter. This specially shaped filter is intended to make the beam more uniform at the detector. Number 3. The beam is collimated to pass through only the slice of interest. Number 4. The beam is attenuated by the patient, or who is in the gantry, and the transmitted radiation is measured by the detectors. Number 5. The detectors convert X-rays into electrical signals. Number 6. The digital data are sent to the computer for image reconstruction. And the last is the constructed image is displayed for viewing and subsequently communicated to the picture archiving and communication system, or PACS. The multi-slice CT scanner refers to a special CT system equipped with a multiple row detector array to simultaneously collect data at different slice locations. The multi-slice CT scanner has the capability of rapidly scanning large longitudinal or Z volume with high Z-axis resolution. The multi-slice helical computed tomography, or MSCT, consists of the following three key components. The first one is the preferred helical pitches. The preferred helical pitches for efficient Z sampling in data collection and better artifact control. And the next one is the new helical interpolation algorithms. This new helical interpolation algorithms is to correct for fast simultaneous patient translation, and the Z-filtering reconstruction for providing multiple trade-offs of the slice thickness, image noise, and artifacts to suit for different application requirements, and is determinants of an optimal image in CT. Number 1 is spatial resolution. The key factor determining the spatial resolution are the detector size in the Z-axis direction, reconstruction algorithms, and patient motion. Spatial resolution is specified in the axial as well as Z-axis plane. Scan plane is also called XY plane, and Z-axis plane is also called out of plane fixed to A and B. The axial or XY plane spatial resolution is dependent on the pixel size, which is a ratio of scan field of view, or SFOV, and image reconstruction matrix. On the other hand, the number of rows in MDCT scanner and the detector size determines the out-of-plane Z-axis resolution. The detector row will define the minimum thickness of the reconstructed CT image and is influenced by the Z-axis dimension of the individual detector element. For example, a detector row width of 0.6 mm allows a slice thickness of 0.6 mm to achieve improved true plane spatial resolution. Some systems use an X-ray focal spot that alternates between two Z positions to acquire two overlapping slices for each detector row. This feature has been reported to improve Z-plane spatial resolution to 0 mm. And the next one is contrast resolution. Contrast resolution is the ability of a CT scanner to differentiate small attenuation differences on the CT image. It is important to remember that the linear attenuation coefficient is an absorption measurement, and it is dependent on thickness of a material, density of a material, atomic number, and photon energy. A change in peak kilovoltage results in alternation of linear attenuation coefficient of the structure, even if the same structure is being imaged. Contrast resolution is limited by noise. As noise in an image increases, contrast resolution decreases. Special filters called Bowlty filters absorb weaker energy photons, which reduce the probability of scattered photons being detected by the CT detectors. An X-ray beam consists of polychromatic photons having different energies. The Bowlty filter serves to absorb lower energy photons primarily to lessen the effect from the absorbed lower energy. An X-ray beam consists of polychromatic photons or photons having different energies. The Bowlty filters serve to absorb lower energy photons primarily to lessen the effect from the polychromatic nature of an X-ray beam. A soft tissue standard or smooth algorithm is used during the reconstruction process to enhance soft tissue and contrast resolution. And the last one is temporary resolution. The temporal resolution is determined by the gantry rotation time, acquisition mode, type of image reconstruction, and pitch. Gantry rotation time is the amount of time required to complete one full rotation, or 360 degree, of the X-ray tube and detector around the patient. The recent advances in technology have considerably decreased the gantry rotation time to as low as 330 to 370 milliseconds. The lesser the gantry rotation time, the greater the temporal resolution achieved. Now, what is the advantages of MSCT? First, substantial reduction of examination time. Second, coverage of extended anatomic structures. Third, substantial increase in longitudinal resolution by means of reduced section width. And there are two more advantages. The fourth is isotropic spatial resolution, and the last one is three-dimensional and multiplanar reconstruction image with resolution similar to transverse sections.
Cost of CT scan. The price of CT scan is differentiated by number of slices. There are 4 until 8 slices. CT system with a lower number of slices are popular as a cost-efficient solution when only basic CT image is required. You are able to perform a wide variety of examination, but they do take longer as only a smaller part of the body is obtained with each image. The cost of used CT scanner with 4 until 8 slices is typically 35,000 until 60,000 euros. Popular system include is GE Lightspeed Ultra. 2. 16 until 32 slices. Price for this CT machine typically range from 60,000 until 100,000 euros. The systems are good for several types of examination. Popular systems are Toshiba Aqualine 16 and Toshiba Aqualine 32. 3. 64 slices. The used system with 64 slices typically costs 90,000 until 130,000 euros. They offer cardiac option, but it is basic cardiac compared to the newer high-end system. Nevertheless, the 60 slice system are popular and great for variety of application. Popular system include is Philips Brilliance 64. 4. 128 slices. These are newer systems that offer excellent image quality and great cardiac option. A used CT machine with 128 slices typically costs 120,000 until €180,000. Popular system is Toshiba Aqualand CX. And the last, we have 256 slides. These are high-end CT scanners that have exceptional image quality and are outstanding for cardiac exams, as they can image the heart in one rotation, which means no sedatives or other medication to decrease the heart rate are necessary. Furthermore, it reduces artifacts caused by movement. The CT have prices that range from €250,000 and upward for a used system. Popular system is Philips Brilliance ICT. Material used for imaging in CT scan. There are three elements or material that CT scan used to produce the X-ray. X-ray is made to display image on CT. There are iodine, barium, and gadolinium. Iodine has an atomic number of 53 and belongs to the halogen group. 2. Barium. Barium has an atomic number of 56 and belongs to the alkali earth metal group. And the last, gadolinium. Gadolinium has an atomic number of 64. Gadolinium belongs to the lanthanide group. These elements are commonly used in medical imaging.
Many statements that mention issues relate to the use of CT scan, but the effect of using CT scan depends to the gender, age, and scanned body part. CT scan can cause cancer, but the probability someone getting cancer from CT scans are 1 to 2,000. So, the fact is that the chance of getting cancer due to the use of CT scans are very small. And then, to reduce the effect of radiation from CT scan, there are safety rules such as doctors are required to use the smallest radiation dose about 1.5 mSv to perform the scan. Besides that, part of the patient's body that don't need to be scanned with a CT scan must be protected with a lid cloth, so that X-rays don't enter part of the body that don't need to be checked. Safe amount of radiation for CT scan imaging. According to Bapeten, dosage limit values for a normal citizen is A. Effective dose of 1 mSv within 1 year. B. The equivalent dose for the APs is 15 mSv in 1 year. And C. Dose equivalent for skin 50 mSv in 1 year. And the following table is the average dose of imaging examination.
Next, Andhika Abyzar, will discuss CT scan maintenance. Like the other instrument, CT scan devices should have a routine maintenance. It took twice per year, and it costs about 12 million rupiah per maintenance. There are some parts that need to be replaced every 2 years. Those parts are batteries, UPS devices, and computer tower bias batteries. So, every 2 years, it took about 60 million rupiah to maintain one CT scan device. We have come to the end of this presentation. Our group draws conclusion by expressing an opinion about CT scan optimization. We believe that the CT scan is a very useful instrument in radio diagnostic. To make CT scan work optimally in helping patients, we need to pay attention to several factors, such as the type of CT scan used, the process of scanning, and the CT scan maintenance to ensure that CT scans still work optimally. In Indonesia, not every hospital must have a CT scan device. Only a few hospitals need the device. Every city at least must have 2 CT scans. We think 4 to 8 slices and 16 to 32 slices is the most suitable device for hospitals. It can be national standard for CT scan in Indonesia. The cost and the maintenance is affordable for all kinds of hospitals in Indonesia. We also think that the high-end CT scan is also needed, but we think every capital of province must have at least one high-end CT scan. Here is a reference to what this group has presented. For your attention and willingness to have listened to this presentation until the end, I am Andhika Abyzar, a representative of this group. I'd like to say thank you very much.